Hello, Dr. Libby here. I wanted to show you how to do the adrenal stress test. So the box looks like this from Diagnostechs. And when you open it up, here is what you're going to find. You're going to find a requisition form. I'll show you how to fill that out in a second. The mailing label. It's going to be postage paid for you to just drop off and have it mailed, UPS. It contains a bag with 5 vials in it. These are all to collect saliva. I'll show you how to do that in a moment. And a little instruction booklet. Let's go through these things one by one. So the requisition form, the important thing is you're going to fill out the top gray shaded area, name, address, and the date that you're collecting the samples and the date that you're shipping the samples. If we have not already marked it for you and you need to choose your test, it's the second one. It's the one that says NLASI. That is the bubble to mark in. And then we are billing the physician clinic. We are paying for this. So we should have this marked in for you. But if not, you can mark that bubble. You do not need to fill out 2, 3, or 4. That is if you're paying for the test yourself or we're trying to bill insurance for it. And so you can leave all that information blank. On the back of the form, there is some stuff for you to fill out too. The top is the exact times you're collecting the samples. So when you take each one, just jot down the time that you took it. And then they also want to know how long it's been since you've eaten prior to taking that sample. Okay, so you'll list the time collected and the time that you last ate prior to that sample over here. And it has just a couple of questions for you. About, do you have bleeding gums? Do you work a night shift? Or do you have an unusual sleep pattern? And then it says, did you perform the carbohydrate stimulation test? The answer is no, we are not doing that part of the test. So just mark no there. And then for women, they're asking you about your cycles. So you can answer that question. Then it has a list of some medications that they're curious if you take. If you don't recognize the name and you have no idea what it is, you probably don't take it. But it does list some things like progesterone or pregnenolone. And so if you take that, you can denote that there. It's also curious about steroids. So if you're on steroids, even steroid cream for some reason, that's important to note here, as well as anti-anxiety or antidepressant medications, antihistamine or a decongestant. So if you're on any of those, go ahead and mark that down as well. So that's the requisition form. Once you fill it out, after you completed the test, it's going to go back in the box. These are the instructions, and you can read them over. Again, ignore the part about the carbohydrate stimulation test. But most of what this packet says, I'm going to be telling you right now in this video too. And then, so let's get to the test itself. There are the 5 vials that you're going to collect. 4 of the vials have a cotton swab in them, and 1 of them is empty. That one's called the H vial, the empty one. So what you're going to do is you're going to wake up in the morning, and before you even brush your teeth, you're going to let your mouth kind of fill up with saliva, and you're going to take one of the cotton swabs from one of those tubes and put it underneath your tongue behind your teeth, and you're going to hold it in your mouth for 5 minutes or so to let it saturate fully with saliva. Then you spit that cotton swab back in the tube, and that's your first test. So first thing in the morning when you wake up before you brush your teeth or eat your breakfast is when you do the first tube. The second tube, you do just like that. You let your mouth fill up with saliva. You put a cotton swab from a different tube behind your teeth, underneath your tongue, hold it there for 5 minutes, let it saturate with saliva. And you're going to do this one right before lunch. And then the third tube, you'll do the same thing, let your mouth collect with saliva, put it behind your teeth, and you're going to do this before dinner, usually 4 to 5 o'clock p.m. before you eat. And the last one, same procedure, but it's right before you go to bed. Okay, again, before you brush your teeth. Okay, so getting ready for bedtime. I think it says somewhere midnight. You don't have to say it till midnight. You do this before you go to bed naturally. Okay. That takes care of 4 of the vials. The 5th vial you need to actually spit in, and it takes a long time. You have to spit and spit and spit and spit and spit and spit. It feels like it's going to take forever for the vial to fill up, but eventually it does fill up. It might take a good 15 minutes to get enough in there. And you need to do this one between the other vials. And so usually around 10 a.m. or 2 p.m. is going to be about the perfect timing to collect this vial with spit. Once you've collected them all, you put them all back in this bag, write your name on each one and your date of birth. And then leave that little absorbent pad in there too, just in case they leak. They can still extract the saliva off of that. You put this back in the box that it came in with the requisition form. And then you take the mailing label and you place it here on top of the box and you drop it off at the UPS store. If you can't take, well, obviously, you can't take it until the next day because your last one's going to be before bedtime. So you can put it in the refrigerator overnight and then take it the next day would be ideal. I think the best day to do the adrenal stress test is on a typical day for you. Okay. It might be more convenient to do it on a lazy Sunday that you don't have anything planned and you can stay in your PJs all day. I love days like that, but that's not going to give us a real accurate assessment of what a normal day in your life looks like. Also, if you have a particularly stressful day, you're giving a big presentation at work that's very unusual for you, or you have to go to a court hearing for some reason, or just something way out of the norm, probably isn't a really good day to do it either. But a normal work day with your normal workload and responsibilities would be ideal. I mean, that's kind of hard because on normal work days, we're kind of busy and collecting all the spit's kind of an inconvenience, but that will give us the most accurate representation. I also think when it comes to caffeine intake and exercise, I just rather you do what you normally do. If you exercise regularly, stick with that exercise routine. If you don't exercise, you don't have to do anything different. And same thing with caffeine. Let's just drink what you normally drink for your caffeine intake. I wouldn't go overly excessive, but just your normal daily intake would be ideal. So I'm very excited to see what this test shows. It yields a lot of really useful information, and getting strong adrenal glands is foundational to optimal health. And we live in a stressful world. I rarely find this test to be optimal. We find it to be normal a lot because normal is age-adjusted means. And so very likely you might be doing on average, like other Americans are doing as well, but we want to be doing better than average, right? And so we're looking for optimal here. So I can't wait to get the results and explain to you what they show and exactly what they mean. Happy spitting.